Have you ever been curious about what happens behind the scenes in the production and recording of these podcast episodes? You know, the bloopers and the mistakes and the funny moments and just all the details that go into it. Well, I'm going to tell you how to become a part of that, or at least get a glimpse of the behind the scenes in a community that we're looking to put together. You're listening to the PHEC podcast, episode 382. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. My team and I are curious to know how you feel about being a part of a community of listeners of the podcast. So what we're talking about is having a community of people, a place where all of you who are listening to the podcast will have an opportunity to gather together with a sense of community and engage with us as a team a little bit more frequently and closely, and also benefit from connecting and networking with each other. So let me explain a little further. Every year around this time, we bring up the topic of this community. We want to have a community like this. We have tried in the past, and it's just been a little difficult to find the right place and location that really would work for us. So we've tried, and it's just been on hold for a couple of years now because actually years back, we had a thriving community inside of Facebook. And then we decided to move away from using Facebook groups. We dissolved that community and we moved everything to LinkedIn. Well, as much as I love LinkedIn and I encourage you all to be on that platform and to be very active on that platform, the one thing that I'm not happy about is the way that their groups function. So we haven't been successful in the type of engagement and the community feel that we really want to have using the LinkedIn platform. So we have a group. You may be in that group on LinkedIn, but it's pretty dormant because it just hasn't been successful. So the last few years, it's just been there and we're not sure what to do with it. So at the end of each year, as we're doing our strategic planning and deciding what to do, what to take away, what to change, and making our plans for the new year, this idea of the community comes up every single time. So this year, we decided to bring it to the podcast and discuss it with you. We have a new option for community that we believe would work really well for us and what we want to accomplish. But we want to get your feedback. We want to know, first of all, if you really want to be a part of a community, what your thoughts are on this, something different versus trying to bring some life back to LinkedIn. You'd have to really convince me to bring some life back to LinkedIn just because we've tried for a couple of years. Like I said, we have over 1,000 members in there, but it's just very difficult to get engagement. So here's what we want to accomplish. First of all, the community is for anyone who listens to the podcast. And we have a very diverse group of listeners and we have a very global audience, which I'm extremely proud of. Whenever we go to conferences, one of the things that I get the most excited about is when someone comes up to me or stops me in the hallway and says, "Oh my gosh, Dr. Huntley, I listened to your podcast. I've been listening to your podcast since grad school," or something along those lines. That never, ever gets old for me. I love it when it happens. My team and I would love to be able to engage with people on a more regular basis who listen to the podcast and are excited about the podcast. And that's one of the reasons we want to have this community, as well as the fact that, like I said, we're a global audience and some people won't bump into me at a conference if they live in a different country and I'm here in the United States and most of my conferences are here. So this community will give us the opportunity to engage a little bit more. Let me give you a couple other benefits that we see in the community and what we envision, a place where we can engage with each other about the podcast topics or episode takeaways. I know that sometimes people will share their takeaways with us on social media in direct messages, and we love that. And we think it would be so much more amplified, like that feeling would be amplified if we were able to share that in a community where a few people, even it doesn't have to be everyone in the community commenting on every single episode, but maybe one episode is going to resonate with a handful of people in that community and they get to continue the conversation in that place, in that space that we would have there. I would love to be able to see that. And that feedback is great for us as a podcast, the host and the team, to know what's really resonating with our listeners, because we want to create more of what you want as well. Another thing is that the behind the scenes, some people really would like to know a little bit more what happens behind the scenes of putting these episodes together. It's quite the production for sure, as well as all the bloopers. You'd be surprised how many times I stumble over my own name and countless other things. And a lot of times things just get cut out and tossed away. But, I'm not going to always share bloopers, but some of them are kind of funny. You might want to see some of those. But just the transparency of being able to see what it's like to put these together behind the scenes, is interesting for some people. And we would like to be able to share a little bit more of that. And we think a community like this will be a fun place to do it. You can meet other professionals. Like I said, we're a very diverse group, and I think it would be nice to be able to engage. You can meet some new folks. So it doesn't matter if you're a student or mid-career professional or senior professional or even a retired professional and you're listening to this podcast, or some combination of all of those. This community would be for all of the commonality is the fact that we all enjoy these episodes and the guests that are coming on the show. Of course, I know what our lineup is like for the first half of next year. We do have a strong lineup for guests on the podcast. And so I know that some of the guests that are coming up would be great conversation to continue in the community, as well as so many guests we've had in the past. This podcast is, 380 plus episodes. That's a lot of talking, a lot of people, and a lot of weeks. So some of these episodes go back way before the pandemic ever started. And the guests that we've had on the podcast over the years, the community would be a great way to share these older episodes as resources and connect with the guests from those episodes and the guests that are coming up. I think that we could all benefit from that kind of exchange in the community. I often have professors and heads of programs at universities share with me that they use this podcast as a resource for their students. I even have a friend who's a professor who has certain episodes as assigned projects for her students to listen and then they discuss in a class setting, which I think is awesome. I know that a lot of people are doing that, but I would like to have a place where I know that that's happening. First of all, it would be great to meet more people that are using these episodes resourcefully like this to share with other students and colleagues. I would love to know more about that. But also just the fact that we could be in a community like this where maybe someone is saying, maybe they say, I'm looking for some material on XYZ, and maybe someone can recommend an episode. My team and I will be in there so we can share these hundreds of episodes as resources to help, attract new professionals into the field of public health and to help broaden their thinking about careers and share these examples of our guests and the work that they're doing. It's just a great way for us to nurture our community of professionals and attract more people to the workforce that we need to do this good work, right? So these are all some of the reasons why we want to have a community and some of the benefits. And if it sounds intriguing to you, here's what I need you to do. Okay. So I'm recording this early, but this is going to be released at the very beginning of December 10th, if it works on like we're scheduling it. So I would like for you to take about maybe a minute or two. We have a 4-question survey, and the link to it is in the description for this episode. Now, we have all been in the situation where we've needed people to respond to our surveys. We all understand the importance of the survey. We want to create more of what you want, and we don't want to create this community if you're not interested in engaging and being a part of it. It's not just enough for us to be excited about it. We want it to be something that you all are excited about and want to participate in. So in this 4-question survey, I tried my best to narrow it down. Please respond. Share your answers, give your responses and share your contact information, because 2 reasons. We want to reach out to you first with whatever we decide to do and give you an opportunity to be a part of it. And then it also allows me to reach out to you if maybe you provide a response that I really want to follow up on. sometimes we do these anonymously and I get some really good responses, and I really wish I could just follow up with that person to get a little bit more or share a little bit more. Just, share your contact information so that we can let you know what we decide to create. And if we don't really get any participation, we won't bother to create anything. But I do hope that we get enough people interested that we can get this started, because I personally would love to have a community that we can grow into the new year. And there's a lot of exciting things happening on the calendar and the plans for us for 2025. And I'd love to have the community growing and thriving at that time. It's been a while since we've had something new for the Public Health Epidemiology Conversations podcast. So this is exciting to have this as a possibility. So again, I'm only asking you to respond. Of course, if you're on the website, you can go to the show notes for this episode, which is 382, and you'll find the link there. But in the description for this episode, if you're listening in one of the apps, the link will be right there. You just click it and respond to those 4 questions. If you receive emails from us regularly, then the email that you receive announcing this episode has the link in it as well. We just need you to go ahead and do it now is the key. So it only takes a minute or so. If you go ahead and do it now, you don't have to worry about getting distracted or coming back to it later. And we get to collect all those responses, because in just a couple of weeks, we're going to make a decision based on what we've received. So if you put it off and you don't get to participate, then your responses won't get counted. All right? Please. I don't ask much. So I am asking you pretty please to take a moment and respond to that to help us out. All right, I'm going to stop right there, because that's the only thing I want you to think about is just responding to that survey. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.